Have you recently been diagnosed with bladder cancer? I'm Dr. Nathan Good, your medical director here at Brio-Medical in the beautiful Scottsdale, Arizona area. When you look at bladder cancer, it's a very aggressive, progressive, highly recurrent, and early metastatic type of cancer that often fails really many different types of therapy, conventional included. The rush is to go to high-dose chemo and surgical removal of the bladder and surrounding lymph nodes. The way we approach the treatment of bladder cancer here at Brio-Medical is actually focusing on the root causes and actually focusing on the precision and accuracy of the metabolomics, the genomics, the proteomics, and transcriptomic behavior of the tumor. So for example, treatments here would begin with nutrition. Alkalinizing through a high plant-based diet will help to alkalinize. Particularly here, we're talking about the excretion products through the urine into the bladder. High-dose IV vitamin C, of course, almost exclusively excreted through the kidneys, and so thus it very much is concentrated into the bladder area. You can actually do photodynamic therapy up into the bladder, accompanying that with IV vitamin C, or even accompanying it with bladder instillation therapy, where you can instill things like curcumin, methylene blue, other photosensitizers, even mistletoe up into the bladder with the photodynamic therapy. That's using different wavelengths of light to actually kill the cancer cells, inhibit angiogenesis, but also work with that photosensitizer to actually upregulate its effect, whether that be methylene blue or curcumin. We also would use immunotherapy here, very important, giving IV mistletoe. I already mentioned the intravesical mistletoe, peptides. These can be given IV, IM, even intravesical or in the bladder as well. So when we look at the treatment of bladder cancer, we really have to dive into the root causes, talking about environmental toxicants, talking about immune dysfunction, talking about metals, but we have to really understand the behavior of the cancer at that moment. Root causes is important, but the behavior of the cancer at that moment is really important towards guiding us into the specific therapies that are designing treatment to target that tumor's behavior. So for example, if a decreased P53 is present, which is a tumor suppressor gene, we are going to do something that is going to increase P53 expression. That's where high-dose IV vitamin C comes in. Certain peptides can also be used there as well. So it's not just about what is the broad-based treatment approach here in the treatment of bladder cancer. There definitely are some therapies that have been shown to be specific and helpful in targeting that type of bladder cancer, but understanding the behavior, the mutations, the metabolomics, the immune dysfunction of this type of cancer can help us actually take these natural, holistic, and integrative therapies and be that much more targeted. That's precision. That's accuracy. That's how we approach the treatment of bladder cancer here at Brio-Medical. To learn more about our treatment of bladder cancer and other types of cancer, I encourage you to go over to our website at brio-medical.com and learn more there. We will be talking to you soon.